Hi, and welcome to this video. This video is really about how to commercialize technologies, either starting from academia or starting from a startup company. So I'll be talking about some hardwares I have in front of me at the moment. I'll talk about the Sense It All platform. I'll also talk about wearables, but I'll essentially jump straight into it. So as I say, this is just a quick video really about commercialization. And I've put here the 2-year sort of manifesto, because we do feel that when people can adopt technologies, and this platform that I'm going to discuss this afternoon is definitely for people who want to get to market quickly. I think people spend a long time developing sensors, developing hardware. Maybe it's in the wearable space, but there's a lot of effort taken in developing this technology, but sadly very few people actually make it to market, and I will address that in this video this afternoon. The topics that I will cover are wearables. As I say, this is a microneedle technology. I'll bring it into this camera here, but this is as I say, a microneedle technology. This is something that ZP owns, including the IP, which is sort of 50 patents behind that. And I'll also be talking about point-of-care diagnostics. A quick rule of thumb is, if you're going to do point-of-care diagnostics, I would suggest that it's sort of the 10th the effort of doing wearables. Wearables is extraordinarily difficult. Just this last couple of weeks, a company called BioLink that does microneedle CGM sensors down in San Diego have just raised another 50 million US dollars, and that's on top of 100 million US dollars that they raised a couple of years ago. So just understand the difficulty in doing wearables. As I say, I'm going to run a 2-year manifesto, or propose a 2-year manifesto, which just basically says that going from idea to commercial availability can take 2 years. But if you go the sort of traditional long route, then essentially it can take 10 to 15 years, and your probability of success is basically about 10%. So I am going to talk about the Sense It All platform. As I say, I do have this platform here today, and I will demonstrate and discuss that. And I also will discuss, but much lighter wearables as well. It's probably worth saying, I'm not going to have any links or comments in this presentation, but we do a webinar every month on both point of care and on wearables. So it's probably worth reaching out to ZP regarding our technologies, and just know that there's always a live webinar every month on this. As I say, at ZP, we do have a lot of wearable technology. I'd say we almost have 2 tiers. There is material that you can get off the web store. There's electrodes you can get off the web store, microneedles you can get off the web store, formulations for things like glucose, lactate, potassium that you can get off the web store, and we have a lot of videos giving out advice. And then there's a higher tier where actually people are interacting with us directly, because actually we do have a patent portfolio and a technology stack. And as I say, this in the video you can see the guy applying it, but what's happening in the video is there are some microneedles on the back of this that can be functionalized for the analyte of interest, the classic being glucose, and so we can functionalize the needles appropriately to actually be able to detect different analytes. But that's a real tier 1 sort of type technology, and that's something that we only use with larger engaged clients, but otherwise there is other technologies on the website available. I'll also talk about point of care this afternoon. I mean, the classic kind of point of care device is actually these kind of glucose meters. I've got one of these glucose meters with me today. I think the glucose meter kind of is a really good representation of what a point of care device actually should be. And I might just change cameras for a second and just show you what's going on here. So I've got a CGM here. I'm just going to get one of these finger prick tests. Not finger prick test. This is actually a Lancet device for getting some blood. So I've just got some blood on my finger here. I'll just bring it to the sensor. Alright, so the blood is just wicking in now. That'll run. What's so nice about that is it represents everything that's good about electrochemical sensors, I would suggest. And the score there is 112 milligrams per deciliter. I know I've got it in the US units there rather than sort of the millimoles that people are more familiar with. It's a little bit higher because actually this is just after lunchtime, but that does represent a lot of what's good about electrochemical point-of-care devices. This kind of technology is small. We have a low-cost disposable. It was rapid. There wasn't much sample preparation, and I think those are all the good things about electrochemical sensors. So I'll be broadening that conversation to actually include this device in a bit, which is our SensiAll platform. But I'll go back to my screen and just say, so we will be discussing point-of-care, and the point-of-care sort of technologies that I will be discussing are based around electrochemical analysis. Now the question here is, why is there a ZP? Why is there a Zimmer and Peacock? And it was really to get people onto the market, but getting people onto the market means basically, I think, means having impact. People are very keen, especially in this academic world, and also in startup as well, is, did you have a positive impact through the work that you did? And I think that electrochemical sensor technology, being point-of-care wearables, can have a positive impact, but in order to have that impact, you have to get it to market. And I would write an argument that, we do have a stack of technologies at Zimmer Peacock. This is the SensiAll platform. It is an open platform that allows other people to develop electrochemical assays and use it upon our platform, and they could even use their own screen printed electrodes as long as they follow some design rules. And it does offer this kind of remote and rapid testing. It does offer affordability. So for example, this is a row I've snapped off some of the sensors here. You'll see me snap off one in a bit. We're retailing these, even at low volume, these sensors for different applications at like sort of €2.50 each. When you look at the cost of medical diagnostics, this is really basically nothing. We will be discussing this app this afternoon. If you're following this on YouTube, you can scan some QR codes in a bit and you'll actually see the broadness of this platform. And I'll also say the reason the broadness of this platform comes from the fact that it can do amperometry, voltammetry, cyclovoltammetry, or voltammetry. So amperometry, potentiometry, voltammetries, and also impedance spectroscopy as well, which is really important. It's also cloud enabled, and I will discuss that, the fact that when you're using this SensiAll platform, actually all the data goes to the cloud, which is really useful, because especially when you're in development or you're starting to work with the first kind of beta users, the question is, where's my data? And your data is automatically in the cloud. And you can plug into third-party systems using an API and application program interface as well. The problem that we're trying to solve through the SensiAll platform really is this, that in order to kind of make a technology commercially available, you have to go through these TRL levels. TRL levels, technology readiness levels, was something that was invented by NASA, but has been kind of broadly taken up by the startup community and also by the academic community. So basic principles is kind of TRL 1. Technology concept is TRL 2. Proof of concept, I think most scientific papers are actually proof of concepts. Technology validation, I think that the data that you get in a scientific paper is TRL 4, but then you start in relevant environments, you start to see people sort of trying to take the technology out of the lab and into the environment, so that's TRL 5. Technology demonstrated, TRL 6. System prototype, and this is what I'll argue in a bit, that the system prototype is essentially, we leapfrog people towards the system prototype because we actually have this SensiAll platform there. They can put their assays and their sensors on that platform. System complete and qualified, I would argue that in a bit that actually we have brought people to TRL 8 and TRL 9, really important, it's deployed, that actually people can essentially order it. Now, this is the spend curve. So you kind of, as you go through all these TRLs, you're spending time, but you're also spending money, and the money basically goes up. Now, people would imagine that they could get this stuff from sort of 1 to 9 in a space of 5 years, whether that's in academia or whether that's in a startup. The reality is it possibly takes 10 to 15 years, and the reality is that only 10% of startups actually ever succeed. So I would sort of argue that the spend goes up as you go up the TRL levels. People say it'll take 5 years. The reality is it takes 10 to 15, and only 10% of those ever really make it to market. So there's something a little bit broken with this traditional route, and the traditional route for me is oh, we're going to design it all in-house. We're going to start off with the electronics. We're going to make sensors. We're going to build a manufacturing line. But I think it basically means that a lot of people just basically don't have impact because actually they spend too much time manually building all of this up. So, we tried to say, okay, well, don't take 10 to 15 years doing this. Take 2 years to do this. But if you're going to take 2 years to do something, you're going to have to cut something. And so we sort of say, because we've built things like these screen printed electrodes upon which these kind of technologies can be built, and because we've built the electronics upon which you can build your assay, and actually there's a app already deployed on the App Store, you can jump or cross off many of the TRLs that would otherwise look like they were impeding you getting to market. Things like system prototype, system complete and qualified, system deployed, these things are already taken care of. But it still leaves value add things for you to do, which is proof of concept. What's the idea? Have you proven that the concept even works? Have you validated it in the lab? It's really sort of saying, right, when you look at a technology like a glucose meter, there's two parts to this. The mechanical, the electronics here, and the sensor here. Which one has the value? It's this that has the value. It's the sensor. If you talk to sort of VCs or people who've got experience in this, you can always do the engineering, but it's the sensor, it's the biochemistry or the bioelectrochemistry is actually the tricky part, and manufacturing this in a repeatable way. So we would like you to actually have more focus on the sensor and getting that right than necessarily repeating effort on electronics, which is why we've actually built this particular platform. So it means you can do proof of concept, you can validate in the environment, and you can demonstrate. And so, for example, when I talk about demonstrating, there is a small part of demonstrating which is actually showing it to potential investors, and people often don't quite get to that point. And people say, "Oh, when I see it, I'll invest in it." Well, with this kind of technology, with the Sense-It-All platform, we have actually allowed people to demonstrate in a period of 3 months from engaging with ZP. There's also something very important as well. At the end of this, there's deployment. So there's you're actually ready to sell to customers, but often you actually have to build an operations team and afford that operations team, which can be quite expensive when you're really only just starting to sell. But if you're using the ZP and ZP platform, you can actually just send us instructions and we will put the electronics and sensors in a box and ship it to the client. And it's basically called drop shipping. And suddenly it means that you've achieved this TRL9. Why? Because you have a distribution or a logistics agreement with ZP. So suddenly you're using our infrastructure to achieve your business needs. And really having a operations team is not necessarily a value add actually for your business. Why are we so obsessed with kind of getting people to market and doing it in the most efficient manner possible? This is the product life cycle for something. So in the early days, you'll find your technology enthusiasts. These could be kind of really enthusiastic clinicians or people who are really leading the thinking in their area. You could have visionaries, people who kind of just like technology, full stop. Then you have pragmatists. These are going to be the biggest group, well, one of the biggest groups in the potential market that you're going to address. And then actually a lot of people in life, 50% of people are probably fairly conservative. And then you actually have these skeptics. These are people that you've got a new technology, it's better than the incumbent technology, but the skeptics are really unlikely to ever adopt your technology. And you can't really put effort into trying to persuade them. But the reason I bring this up is because there's actually a chasm here. There's a guy called Jeffrey Moore, and he wrote a book called Crossing the Chasm. And what he says there is you can find those technology enthusiasts and those visionaries quite early on. But actually, there's a gap here, and you've got to understand that most people are actually pragmatists, and it's going to take a long time for them to adopt your technology. So if you spend a lot of time building a Me Too, electrochemical reader, then you're wasting time really thinking about actually how you're going to deal with the pragmatists, because most of the people you want to sell to are going to need a lot of persuading. So you've only got a certain amount of intellectual bandwidth, and it's actually better off understanding that there's going to be a real problem when you get to market. And you should start with your intellectual bandwidth thinking now on that problem. So we have a platform called Sense-It-All. It does take care of one of the TRLs, which is actually talking about distribution. So if you're watching a YouTube video of this, then hopefully you can scan this QR code off your Android phone and install the Sense-It-All app on your phone. If you're using an iOS phone, an Apple phone, then you can scan this code and this will download the app onto your Apple phone. For this is just to really demonstrate that actually this is not a one-trick pony in terms of the Sense All platform. The only reason we call it Sense All, it's really an OEM system, an original equipment manufacturing system, but it can do many things. So we use it, for example, with chilies. We use it to measure ginger. These are because these two materials have a small molecule in them, capsaicin and gingerol. pH, we use it for pH. pH is one of the, and pH is interesting actually because you could have an idea that is about measuring pH, but it's the application itself which is unique. So some people use pH measurements to measure DNA hybridization, for example. So many applications for pH. Just know that if we've got it on our platform, then you can start using our platform to explore a particular application of pH. Nitrate, very important for water quality. Total antioxidative capacity. This can be used in the food industries. It can be used in the wellness markets as well. Glucose, there's plenty of applications for food, both again in food and in health and wellness. Potassium definitely appears in the care of dialysis patients, people interested in hydration. Potassium is definitely an interesting analyte. And then I have this QR code here, which is a generic QR code, and you can actually, that could be a QR code that you can end up changing so that our platform doesn't say Zimmer and Peacock, but actually says your brand, your assay, and has all the details to run your particular assay. I will do a demonstration in a bit, so this will become a little bit clearer hopefully when I actually do the demonstration. So every time you scan a QR code, the QR code will open up a different looking screen. So this is the TAS, this is the glucose, this is the potassium, and as I said, there's a generic one as well called Sensor, and that's because we have all these fields that you can basically fill in. So you can rewind this video, install the app, and have a little play with some of those QR codes. It's probably just worth saying that at ZP, one of the things that means that we can get people to market so quickly is as long as they're using our screen printed electrodes. Our screen printed electrodes are really, they're compatible with the Sense All platform. So even if people are purchasing screen printed electrodes off us, there's actually a platform that can take those screen printed electrodes or those biosensors built upon those screen printed electrodes and actually help commercialize them. But it's one of the sort of foundations of this platform is actually these affordable screen printed electrodes. And what's really good about them is their repeatability, their reliability, their reproducibility. These are kind of synonymous words with one another, but it basically means if you test them with the same analyte, you'll get the same signal every time. And we guarantee that through the amount of testing that we actually do before they actually get shipped. So if you're thinking about doing a startup or you're thinking about academic research, I think you can really speed up your work if you're actually using our screen printed electrodes. And I'll be putting this video up on YouTube later on, so I'll make sure that these links are there as well. We do have a host of biosensors at ZP. All of these biosensors are actually applicable to the Sense All platform. But the Sense All platform is more than just our stuff. I really want it to be your stuff is being used upon it. We can define the word stuff as biosensors and assays that you've developed for applications that you've thought about. We do have a whole series of sort of electronics, and I'll just put some links there as well. But otherwise I shall skip through. So we got this hardware. I put my hand on the hardware there so you can get a scale of it. This is what it looks like. There's these kind of LEDs on the front of it, which help guide the user experience, but you'll probably see that in the demo in a minute. Anyway, this hardware is pretty powerful. It can do amperometry, so if you've got a background in kind of electrochemical assays, you'll understand that. Potentiometry, voltammetry, and impedance spectroscopy. The way the technology stack actually works is that we have, so for example, there's a sensor. This could be something that you got from us or something that you developed yourself. There's the Sense All platform. There's the app. Don't forget there's some QR codes earlier on in this that you can start installing this app on that. The app will connect to the hardware, and the app also connects to a cloud system called Julie. So you put the sensor into the meter, you put the sample on the meter is run by the app gets the data back from the meter, the app sends the data to the cloud, you get a result on your phone, but also know that the raw signal, the operator name, i.e. my name in this case, and date and time are all saved to the cloud, and then you can start sharing that through this cloud system with your colleagues as well. And there's also an API, an application program interface. This is really important because we've really thought ahead and actually know that even if you do a startup or you're doing a company or you're doing an academic research, people want to plug systems together these days, and the API is built in. So I say here, I'm going to do a quick demo. What I've done is I've just changed to an external screen. So what I'm going to do is I'm going to take one of these sensors. I'm just going to sort of demonstrate how this platform really works. So here's the sensor, and I will put it into the meter. There's no aligning it, there's no slots. Yeah, we've really thought about that kind of user experience. I'll take a sample here. This is another joy about electrochemistry. We only need, in this case, this is quite a lot of sample for us. So I'm going to put 50 microliters on here. 50 microliters is a bit like a sort of a large drop. It's one of the powers of, as I say, electrochemistry. You can see that we have in no way optimized this by putting microfluidics or something like that on there. So I have the app on my phone, and what I'm going to do is I'm just going to click a button down here that says go to assay. In this case, I've done a dilution on this particular sample. You don't always have to do that. And then I'm just going to do start measurement. I think this also demonstrates one of the powers of electrochemistry. You can see a little bit of flashing going on at the moment. That's because it's the hardware telling me visually that it is actually running the assay, and you can see I also get that kind of certainty or reassurance as well from the actual from the app itself. So we've got a progress bar running here. It should be over in a few seconds, and then we'll get the result on our phone, and it will upload. And it has uploaded. So I'll read it out because I know it's a little small and a little bit too bright, but it's given me the concentration here as 414 parts per million, and it also says that the upload is complete. So I will slightly change screens for a second. So I'm just going to quickly bring up, and it's not something that I've really discussed so far. Well, I think I might have briefly discussed it, but I will just. So what I'm going to do is quickly bring this up. So you should see this. This is a cloud system called Julie, and what Julie is receiving data. So if I just kind of refresh this. It's what it's doing then is I can see the new result here, and I can actually see my raw signal up in the cloud. I can see details when things actually took place, and I can see my raw signal as well. This is super useful, and I'm not really going to sort of plug into the API now, but this is super useful, especially when you're in a kind of, you're dealing with alpha and beta testers. It answers the question, where is my data? And the answer is your data is automatically in the cloud. So I can see the actual results, and I can see the raw signal, and I can see what time and who gathered the raw signal. So it gives me a lot of information that I essentially need to really help in my development, if I can put it that way. So if I was to summarize this, what I've done very quickly this afternoon is just said there's a lot of impact by getting technologies onto the market. People can spend a long time really reinventing the wheel. If people are using things like our screen printed electrode or even our biosensors in conjunction with our Sense It All platform, they've suddenly leapt many of the TRL levels that are otherwise holding them back from having an impact. And so I would suggest that if you've got any questions regarding Zimmer and Peacock, things from the electronics, the screen printed electrodes, the Sense It All platform, then please don't hesitate to reach out to us. So I would just want to finish with a sort of thank you very much, and our contact details here. But as I say, if you've got any questions, don't hesitate to reach out to ZP. Okay, thanks very much.